Hello, welcome again to this channel where we give the essentials of medical information. For the new subscribers, welcome. Don't forget to hit the notification bell so that you get to be notified each and every time I upload a new video. For the returning subscribers, thank you so much for always checking on this channel. My name is Rebecca Morangi, and this is the best place to be. We have been talking about the thyroid disorders. One of the disorders we mentioned is hyperthyroidism, and one of the major causes was Graves' disease. Today, we are going to look at Graves' disease on its own and get to understand more about it. Graves' disease is an autoimmune condition or disorder where your immune system attacks the health cells of your thyroid gland, and the common cause mostly it's not known. The thyroid gland has got different functions: regulating of body temperature, body metabolism, regulating your mood, among many others. This condition can be brought about, or there are some risk factors. One is those who smoke. Lupus, this is a condition which can lead to this. Arthritis, diabetes type 1, celiac disease, and those who have vitiligo. Vitiligo is where your body parts, some body parts appear to be lighter than normal. Symptoms of Graves' disease, they are the same as the ones in hyperthyroidism, where somebody can lose weight, others can get diarrhea because of the increased body metabolism, loss of hair, fatigue, muscle weakness. Some people can have what we call thyroid eyes, bulging of the eyes. Those ones are some of the symptoms of Graves' disease. The cause of Graves' disease actually comes as a result of the malfunction the immune system. Normally, the immune system produces antibodies, which are produced by the white blood cells to protect our bodies from getting infections from either bacteria or viruses. Now, when your immune system starts to or fails to function normally, it can lead to this condition. How? This is when your immune system now produces antibodies which attacks the health cells of the thyroid gland, leading to overproduction of thyroid hormones. Now, those are in abnormal cases, and this one causes the Graves' disease. Actually, it's called Graves' disease because of the scientist who discovered the condition back in 1800s. Recently, on May 25th, we were talking about celebration of World Thyroid Day. Those are some of the people actually are supposed to be celebrated because of discovering this condition. They contributed to this discovery. Now, how can this condition be triggered? Some conditions can trigger this. One, it could be by environmental factors, all genetic predispositions. Environmental factors and genetic predispositions can be maybe viruses, which can cause infections, pregnancy, those who smoke, other autoimmune conditions, stress. If somebody cannot manage stress well, it can lead to this condition. The sex of a person, if you are a woman, you are more disposed than men. Age, if you are above 40 years, these ones can trigger this condition. This condition can be diagnosed in different ways. One is through blood test, T3, T4, and even the TSH, which is secreted by the pituitary gland. They are tested. If the TSH, thyroid stimulating hormone, is low and the T4 and T3 are high, that is a confirmatory test of this condition. Antibody test can be done. What other test is thyroid uptake scan and even a medical history. Doctor can decide to take a history of somebody and get to understand whether it can lead to this condition. Treatment of this condition, it's not different from other thyroid disorders. One is through beta blockers. Reason as to why beta blockers like propranolol are given is to protect your heart. Remember, we said one of the symptoms is irregular heartbeat or palpitations. So you are given beta blockers to protect your heart and to minimize this hyperthyroidism. I believe you are connecting the reason as to why I'm saying hyperthyroidism conditions. We said the symptoms are the same as the ones in Graves' disease. Other antithyroid medications can be given. Methimazole can be given. Propylthiouracil. These ones are given in the case of hyperthyroidism to minimize the symptoms also of hyperthyroidism because of the overproduction of thyroid hormones. Radioiodine therapy and even surgery can be done, removing of your entire thyroid gland. And remember, you have to be in hormone replacement therapy, like a molecule called levothyroxine medication, to produce or to manufacture these thyroid hormones, the T3 and T4, for the body to function in a normal way. Part of your thyroid can be removed, what you call lobectomy. Also, you have to be on this medication because the thyroid hormones which will be produced will be low. So in some conditions, one has to be on this anti-thyroid or thyroid replacement therapy medication. Now, what are the complications? The complications of this Graves' disease, one is brittle bones or osteoporosis, because high amount of thyroid hormones in your body can bring imbalance, can make your body not to incorporate calcium back to your body, which can lead to brittle bones or the break of your bones. That is a complication. Thyroid storm. Thyroid storm is where somebody can have fevers, irregular heartbeat. These are some of the symptoms of the thyroid storm. If this condition, hyperthyroidism, all Graves' disease symptoms, all condition is not treated, it can lead to that complication. Others can have complication in pregnancy, and also your heart can fail. Those are some of the complications of Graves' disease. Up to this level, I believe you have gotten to understand what you call Graves' disease. You have heard that it's an autoimmune disorder or condition caused when your immune system attacks the health cells of your thyroid gland. You have looked at the functions, actually you've been looking at it, of the thyroid gland, the risk factors of this, which can increase this condition, the symptoms, which are the same as the ones in hyperthyroidism. What happens in normal cases in your with your immune system, which protects us, and in abnormal cases, which causes this Graves' disease. We have looked at the triggers of this Graves' disease. We have looked at the diagnosis and the treatment of this Graves' disease. Finally, the complications of Graves' disease. Now, apart from the normal treatment, somebody can fight this hyperthyroidism or Graves' disease symptoms by incorporating exercise alongside your medication or the treatment with your doctors. Do a lot of exercise, you'll fight this fatigue. As we move on, we'll look at many things or the natural ways of dealing with these conditions. Thank you so much for checking on this video. Leave the comments below so that you get to know what you understand from this topic. Give us your experience also. Thank you so much for checking on this video. Let's meet in the next video. Bye bye.